Yeah.
Good afternoon. I'm Michael Mallinson, President of the Canadian Spondylitis Association. I'm in Ottawa for the Canadian Rheumatology Association annual meeting, and joining me this afternoon is Jocelyn Murdoch. So, Jocelyn, I'm very pleased to have you here. Could you just tell me a little bit about yourself and your role in rheumatology?
Sure. My name is Jocelyn Murdoch, and I'm an advanced practice occupational therapist who works at the Arthritis Society. And I'm based out of the Sudbury office in Ontario. And I provide services to over a 400,000 square kilometer area of patients. So it's actually quite a large catchment area. And my role is to do thorough assessments with them and to see what I can do to help them get to see a rheumatologist, because we certainly have quite the shortage where I'm located. And then between rheumatology visits, I help my patients navigate the healthcare system.
I see. You're giving a presentation, Rheumatology Care Redesigned, Models of Care in Action. You can do it too. Can you tell us a little bit about your presentation? What are the key takeaways and messages in that presentation?
Sure. So it's a models of care presentation, and I think as healthcare providers, we have a responsibility to continue to evaluate whether what we're doing is working and whether change is needed. And the rheumatology workforce is aging, and the number of people with arthritis is increasing. So it's going to be harder and harder to continue providing the same level of care if we don't look at different models of care to deliver the services that we already are. So the model of care that I'm presenting tomorrow is a telemedicine model of care. And the history behind it is I started using telemedicine back in 2009. At the time, I frankly got sick of traveling. I was traveling over 1,500 kilometers a month to rural and remote communities, and I had patients coming in from 6 and 7 hours away to see me because they couldn't access care. So I started seeing those patients from the really rural communities by telemedicine instead. And shortly after I started, I got my own telemedicine system, and it just snowballed from there. So telemedicine is pretty cool. There are a lot of great things about it. One of the things that's really nice is it's free to use, and it's really available all through the country. And it can be accessed at most healthcare facilities. And in addition, there are a lot of great programs with it, like the ones that are offered by the Ontario Telemedicine Network. They have something called GuestLink, where you can actually connect to your patients with a laptop or a mobile device. It doesn't have to be, a $15,000 telemedicine system. And so it saves time, and it really makes a big difference for families who have a person who has arthritis. So for instance, if one of my patients is in Wawa and their rheumatologist is in Toronto and their daughter is in Belleville, they could all attend a session together without leaving their hometown. So it's actually an amazing technology. The applications for it are endless.
Who initiates that? How do you actually get the patient involved in a telehealth model of care like that? Yeah,
so usually I'm the one who initiates it. I assess them, and I work with 9 different rheumatologists, and I have clinics that are telemedicine clinics across my area. And if they meet the criteria for one of those clinics, then I can slot them in myself, and I book the appointment, and then the day of the appointment, I attend the appointment with the patient, I take notes for them, and I answer any questions they might have after, and then I take care of them after the visit as well, between the times when they're seeing the rheumatologist, because the rheumatologist isn't actually there to touch them or to help them between visits if they run into a problem.
I see. And the rheumatologist just dedicates some certain time for the telehealth calls every week or month or something?
Yeah, so typically they set aside a morning or an afternoon, a month or twice a month.
Mm-hmm.
Yeah. And then we book some patients.
Who actually would do the joint exams then? And
I do the joint exams. Yeah.
I see.
Yeah. And that's one of the key pieces is you do need somebody who's trained in arthritis care, and you need somebody who's pretty comfortable. I'm one of the, what they call ACPAC therapists, so the Advanced Clinician Practitioner in Arthritis Care Program. It's a postgraduate course, and trains OTs and physiotherapists to really deliver a shared care model working alongside rheumatologists. And you really do need somebody with that skill level on the other end. Otherwise, you can't be confident that a swollen joint is a swollen joint and that the patient is actually well or not well.
Yeah. Oh, that's great to hear. Now, just in terms of the model of care, what can someone living with arthritis do to improve their own arthritis care?
You know, I think one of the most important things is knowing what's being offered in your community, and then speaking to your healthcare team about what's working for you and what's not, and what are the barriers to care. I think a lot of appointments are so quick these days that it's easy for providers to forget that you might have traveled 6 hours to get there, you had to take a day off, your spouse had to take a day off, you had to get a hotel room the night before, and they don't recognize those things because the appointment is so very quick and you're focused on your health. But there are so many other things that might help, and so if you bring those issues up, a lot of times providers will actually change the way they practice. And that's where a lot of the models of care are stemming from, is these opportunities for change and realizing that something is a big barrier. A lot of opportunities exist.
I see. Okay. That's really interesting. I'm just wondering if there are any questions from the audience at this stage.
So there's someone asking where this is this available Canada-wide right now, or?
Yeah, so right now I'm in the Northeast, and there are, I think, over 60 advanced clinician practitioners who are trained across Canada now, and we're located a little bit everywhere. Obviously, the program is based in Ontario, so most of us are in Ontario, but there are some from Quebec. I believe there's one from Newfoundland now. There's a few in Alberta, a few in BC.
And so, is there a website that they can go to?
So that's the thing. I'm not sure, because we're all hired by different agencies. So I work for the Arthritis Society, and there are probably 20-some of us there. Others are through big hospitals that already offer rheumatology services. So where there are groupings of rheumatologists, often they'll have an advanced clinician practitioner. But any rheumatologist could offer this service as long as they had somebody on the other end that they trusted to do the joint count.
Do you have any link in with Telehealth Ontario? I mean, if somebody called them because they suspected that they had some form of arthritis, do they refer that person to you? Or?
So what happens right now, if we do get quite a few referrals from Ontario Telemedicine Network, and often they're physician referrals. People aren't self-referring, at least at this point. But if people do want to self-refer, they can always refer, at least in Ontario, to the Arthritis Society. And they can get through to one of us through there.
Okay. Very good. Thank you very much for
You're
joining
welcome.
us this afternoon.
Thank you.
We're off air.
Yep.
That went really well. Thank you very much. Have you wine now?
Yeah, I do have some wine. I threw up this afternoon. I felt so nauseous. I was so nervous. Oh my goodness.
It's funny because actually if you were face to face with patients, you wouldn't feel any nerves.